I was reading before this show about a person that their GI tract just dominated their life. They felt like they were bloating out and they had increased abdominal girth and they were passing gas and they were belching and they were cramping and they were afraid to go out and be with people, or afraid to go to work, or afraid to do anything.
Yeah.
So what's going on?
Yeah, that's a problem. That's either because of two things. It's either because, one, they have a real condition that's making all those symptoms terrible, or they have just a oversensitivity to things. We call that visceral hypersensitivity, where they're just more sensitive than others. For example, if I were to take a normal person and I were to put a tube in their nose all the way into their bowels, and let's say I got a quart of room air and I just pushed it down the tube, a normal person would say, "Oh, I'm a little bloated," and they'd go in a corner, they'd pass it out, they'd feel better. But if I take someone with irritable bowel syndrome, tube in the nose, quart of room air, and push the tube and pushed it into their bowels, the IBS patient would say, oh, it burns, it stings, it doesn't feel well, something's really wrong with this.
Yeah.
Both of those patients have the exact amount of gas. It's just that the ones with IBS are more sensitive, not this nerve sensitive, but these nerves being sensitive.
So does this have anything to do with this? If they get anxiety, if they've got stress, if they can't handle society well, does that come, sometimes it comes out in headaches.
Yeah.
So I imagine it can come out in the gut also.
For the most part, we feel that people who have the irritable bowel syndrome have a very normal this nerve. It's these nerves that aren't. But this nerve is responding to this nerve to say, wait a minute, something doesn't feel right. They talk about how patients with IBS feel everything in their belly, whereas normal people without IBS are able to shut off those feelings. Just like you and I don't feel the shoe on our foot every minute of every second of every... If you want to think about it, you could feel a foot, but in reality, you don't feel that every moment. But IBS patients can't shut that off.
They just feel.
And they just feel it all the time. And over time, that feeling makes them scared or nervous or just anxious about things.